Esophageal cancer is one of the most challenging diagnoses in modern medicine. Worldwide, it ranks among the most serious cancers, and the statistics reflect that reality. The 5-year survival rate is around 22%. One big reason? It's often a hard-to-detect condition. Most people have no major symptoms until it has already started spreading. But here's the question. Can surgery really turn those odds around? The answer might surprise you. In fact, for thousands of patients, a single operation has completely changed the outcome. And later in this video, I'll reveal a fascinating factor that predicts how successful this surgery can be. Most people have never heard of it. Imagine living your everyday life, working, exercising, feeling fine, until something as small as trouble swallowing starts slowing you down. That's exactly what happened to David, a 62-year-old architect who loved hiking every weekend. At first, he thought it was just heartburn. He adjusted his diet, ate slower, drank more water. But the discomfort didn't go away. Then one morning, after struggling through breakfast, he finally called his doctor. That call would change everything. And what they discovered shocked him, and it could easily happen to someone like you. Section 1. Why it's so hard to detect. David's experience is more common than most people realize. Symptoms start small, a little discomfort, a sense of fullness, maybe even some weight loss that feels positive at first. But then came the moment that made him act. He choked on a piece of bread. That led to tests, and the diagnosis no one wants to hear. Stage 2, esophageal cancer. If you had a persistent symptom for months, would you get it checked or hope it goes away on its own? Most of us wait, assuming it's nothing serious. But when it comes to conditions like this, early action can make all the difference. So why is this cancer so hard to catch early? And what makes surgery such a game changer? You'll see in a moment. Section 2. Why surgery matters. To understand why surgery is so important, let's look at how this condition behaves. The esophagus is flexible, which means tumors can grow quite large before they cause noticeable issues. By the time people feel something is wrong, the cancer may already have spread. What's scarier, knowing about a problem early or finding out when it's almost too late? Most people fear early detection, but the truth is, it gives us the most options for successful treatment. And speaking of treatment, there's something about how surgeons approach this operation that might surprise you. Section 3. The turning point, how it works. For patients like David, surgery offers the best chance for long-term survival, but only if the cancer is still confined to certain areas. Doctors use a strategy called multimodal therapy, a combination of chemotherapy, targeted radiation, and then the critical step, an esophagectomy, the surgery to remove the cancer. If you knew one big decision could change your future, how would you approach it? Most people hesitate because of fear, but informed decisions are often life-changing. But here's where it gets interesting. The surgery isn't what you might imagine. In fact, it's one of the most advanced procedures in modern medicine. Section 4. Inside the surgery. So, what exactly happens during this operation? Surgeons remove the affected part of the esophagus, part of the stomach, and nearby lymph nodes. Then, they reconstruct the digestive tract, reshaping the stomach and connecting it back to the esophagus. Years ago, this required large incisions and long recovery times. Today, robotic-assisted techniques make it far less invasive. Would you trust a robot in the operating room? Many patients do, because robotic systems allow surgeons to work with precision beyond human capability, meaning safer, more accurate surgery. And the results? They can be life-changing, but only if one key factor is in place. We'll reveal that in a moment. Section 5. Recovery in AMP. Results. For David, the road back wasn't easy, but it was worth it. The tumor was gone, and his follow-up scans were clear. Recovery meant small, frequent meals and rebuilding strength, but every step was progress. 6 months later, he was hiking again. Different pace, different rules, but the same love for life. If you had to choose between short-term discomfort or long-term uncertainty, which would you pick? Most people choose comfort now, but those who plan for the future often get the best outcomes. And this brings us to the most important piece, the mindset that makes all the difference. Final section. The takeaway. The real secret? Awareness. Recognizing symptoms early, asking questions, and acting quickly. If you experience persistent swallowing issues, unexplained weight changes, or ongoing heartburn, don't ignore them. The earlier it's caught, the more options you have, and surgery can truly change the game. What would happen if you treated your health signals as a priority instead of an afterthought? You'd likely prevent bigger challenges and maybe even save your life. If this video helped you, share it with someone who needs this information. And don't miss our next video. We'll explore the latest breakthroughs in minimally invasive cancer treatments that are transforming recovery times.